Good afternoon and welcome to Structuring AI Governance Without Sacrificing Speed, a health system CIO production. Just a little housekeeping before we start. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health Systems CIO, and I'll be your moderator today. We're looking forward to your participation. You could send in your questions or comments at any time in the Q&A box, and we'll take those later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Stuart James, VP, Chief Operations Officer, and Deputy CIO with Christus Health, Reed Steffen, VP and CIO at St. Luke's Health System, and Tanya Townsend, Chief Information and Digital Officer with Stanford Children's Health and Lucille Packard Children's Hospital, Stanford. And then we will have our Q&A. So let's jump right in. Important conversation today and excited to have it. Stuart, let's start with you. Can you give us an overview of your organization and your role?
Sure. So I'm with Christus Health. We are an integrated delivery network headquartered in Dallas, Texas. We've got operations, hospitals, clinics, health plans, ambulatory surgery centers in the U.S. and Texas, Louisiana, New Mexico. And we also have operations in Mexico, Colombia, and Chile. So we serve the full spectrum of healthcare services. I'm here as the Deputy CIO and Chief Operations Officer. I've got responsibility for applications, data integrations, and a lot of the core functions within information services.
All right, very good. Thank you, Stuart. Reed?
Yeah, good morning, everyone. Reed Steffen, CIO at St. Luke's Health System. We're an Idaho-based, community-focused nonprofit health system. We deliver care, we coordinate care, we fund care. Like all of you, we're excited yet a little bit terrified about navigating this complex terrain of AI across our domains.
All right, very good, Reed. Thank you. Tanya?
All right, good morning. Tanya Townsend, Chief Information and Digital Officer with Stanford Medicine Children's Health, sometimes also referred to as the Lucille Packard Children's Hospital. We are the pediatric teaching hospital of Stanford Medicine and one of the only level 1 pediatric trauma centers in the area, located here in beautiful Palo Alto, California. I've just been here a couple of years, but been doing healthcare IT for a long time and excited to learn from my panelists and talk about AI today.
All right, excellent. Let's jump right in. How do you define AI governance, and to what degree is it? To me, this is going to be the central theme of, as I was, looking over the questions a final time this morning. The central theme to me, the thing that keeps coming up is, to what degree is IT need to be involved in any of these aspects of what we're going to discuss? Lead, follow, support. So that to me is the core issue here. We know these things need to get done and set up and established, but what is the role of the IT executives in health systems in moving these things forward? So to what degree is IT involved with the creation and ongoing operation of it? And we could have sort of what's going on and maybe what should be going on, or the direction you'd like to go in. It may be, we're doing this, but I think we need to do more, or but I think the clinicians need to, grab more of this. Anyway, Stuart, let's start with you.
Sure. So I have tried very hard not to define AI governance. And what I mean by that is AI is a technology. It's an exciting new technology, but we've always had technology governance. So I've been pushing very hard to say that our existing technology governance structures should govern AI. Now, obviously, AI brings some new challenges for that technology governance, but at the core, you're still doing the same thing, right? You're managing to ensure that the technology aligns with your business needs. You're managing to ensure that it's safe, that your data policies are there, that your security is there. And so these things are not necessarily different fundamentally because it's AI, right? You should be doing these things for every technology. And yes, AI brings a new set of challenges to how you govern technology, but I've tried to resist the need to create a separate AI governance. The other thing is AI doesn't stand alone, right? You're not just going to go out and buy AI. It's largely embedded in the technologies you're already buying. So how do you adjust your governance to account for that is where I would like to see things stay. But like everything else, there's nothing exciting about governing technology, but there's a lot of excitement about governing AI. So you see,
Yeah.
everybody now wants to talk about AI governance, but for decades, nobody's wanted to talk about technology governance. So trying to bring them together has been a little bit of a challenge for me and my colleagues that I've spoken to. And so what we've ended up with here, which is the existing technology governance structures stay in place, but we've added a layer on top of it with senior leaders who are taking a specific look at anything AI. And I think that's necessary because everybody from your boards down is wanting to ask you about how you're governing AI. So there's a different level of pressure and scrutiny in anything that has an A or an I in it. But hopefully, as we do that, we don't lose sight of the fundamentals of technology governance. The second part of the question, to what degree is IT involved? I think technology governance works best when you've got it operationally led and supported and enabled by IT. So we should be on those committees. We should be trusted advisors. We should be the ones who do a lot of due diligence and help the committee to make informed decisions. But as I always tell people, we really shouldn't govern ourselves. So I like to see it operationally led, but really supported and enabled by the IT team.
All right, let me follow up with you there, Stuart. So you said you're trying really hard sort of to hold the line in a sense for what you believe will work best. And that is sort of makes me think that there are people that are disagreeing with you, or there are people that are saying, "Hey, what do you mean? Of course you need AI governance." And you're like, "No, you're trying to explain yourself, trying to keep the structure you think works best." Can you tell me a little bit about that dynamic of people questioning, your view on this?
It's not so much people questioning the view, it's just having to bring them back to, hey, this is not, this governance structure, the governance framework and fundamentals are not new because of AI, right? It's what I said. Because AI has made such a game-changing difference, you're hearing questions like the subject of this webinar, like, hey, AI governance. When was
Mm,
the last time you heard anybody ask about technology governance? So the challenge is just bringing the two together and trying to keep people focused on it. It's the classic, I would say, 80-20, even though I think it's more than 80. 80% of what we need to do to govern AI, at least 80%, is already embedded in just good technology governance if you're doing that at any type of maturity. And
uh-huh.
yes, there's some new things about AI, right? A higher level of transparency, the way you communicate about it. If you get into Gen AI, there's a higher level of scrutiny. So I think that's the difference is your governance has got to evolve and mature, but you shouldn't fundamentally say, hey, here's this thing we've never done before and start a whole new governance structure. You should
Very,
quit what you've got and enhance it where appropriate.
yeah, you said you added a layer, and I want to hear from the others, and maybe we'll come back to that concept of adding a layer with, without maybe adding a whole new governance structure. But let's hear from Reed, your thoughts.
Yeah, I think about it as IT is holding a flashlight, right? Kind of shining the way on the path ahead. But the governance really only works effectively when we're walking the path together with our colleagues. So our role is really a facilitator. We're developing tools, we're managing risk reviews, we're integrating AI. I agree with Stuart into the broader governance. It doesn't need its own standalone governance. But for us, the secret sauce is really the collaborative foundation. It works best when we bring together legal, clinical, compliance, DEI, ethics, and more. And it's really a shared responsibility, not something viewed as an IT governance owned initiative.
Um, do we need to talk about who leads? Because, if we're supporting and the other side wants to be supporting and nobody's leading, like who leads? Reed?
Yeah, so I think in my view, IT is leading in the sense of that kind of flashlight analogy. So like we're helping to kind of like shine the way, but
Uh-huh.
not getting so far out ahead or shine the light too bright that we then create a disconnect or confusion across the system. And so we really found that kind of like with cyber, yeah, so our cyber team owns it, but we really view it as a shared responsibility across the enterprise. And we found with AI, that same mindset is serving us really well.
Okay.
So we may be holding the flashlight, but we're not like always out there saying, hey, we're leading the charge, we own this, follow us. It really needs to be kind of a shared journey, I think, to be effective.
All right, very good. Tanya, your thoughts?
Yeah, completely agree with what has been said so far. I like the analogy of like, let's not create another governance, let's leverage what we already have. So I completely agree. That's what we're doing as well. So our AI governance framework does report into what we already had established as our overall IT governance model. In fact, I'm working on trying to consolidate and simplify the governance model right now because there's a lot of complexity in many layers. AI right now does have kind of three layers within it that does report into our overall framework of IT steering committee and IT governance. I also like the comment that AI doesn't necessarily need to stand all by itself. There's so many ways that it crosses many of our tools and systems and technologies that we already have in place. So really need to think about how it integrates across all of these platforms, not just the standalone platform that we have to evaluate all by itself. Um, yeah, I could go on, but very much support what everyone has already said as well.
So, Tanya,
Just
go ahead, Stuart. Please jump in.
follow up that this question of who leads is a very interesting one, and I liked Reed's answer. Right, this is a shared responsibility, it's collaborative. But I think from a practical and an optics perspective, I think it's important that governance is led by operations. Now, whether that's a senior clinical executive, a senior revenue cycle executive, a compliance executive. So I typically, and often you see there's a dyad, right? The CIO or a senior IT exec would co-chair the governance committee with the senior operational leader. But the idea is we exist in service of operations of the business, right? It's not about the technology. And one of the biggest roles of governance is to make sure that the technology is aligning with the needs of the organization and delivering value. Well, that's not determined by the IS team. So even though we have a very big role in the heavy lifting and the logistics and the vetting, that shared responsibility that Reed mentioned, where you have a senior leader who is not IS, who is at least co-chairing the governance committee, I've always found to be an important aspect of governance.
So, I just had an interesting thought, Stuart. And I get what you're saying, and that we want an operational leader to lead this. And then I just wrote down that maybe it's IT's job to lead them into that leadership position. You see what I'm saying? So, because if we're just waiting for someone else to lead, or we think someone else needs to lead, and they're busy doing surgery,
Yeah.
right, or whatever, and they're like, "Yeah, I'm a clinician," and you're like, "No, but we need to tell them and help create structures, and then put them in that position. Otherwise, we may just be waiting for something, and it isn't going to happen." Does that make sense?
It does, and it's this idea, and I see Reed has come off mute, so I have a comment as well. But this is the idea of IT, which is where we're a trusted advisor and an influencer, right? So we are leaders and we help. But if you're doing this right, your senior leadership team will be looking to you for advice and guidance about all things technology. So if you have that trusted advisor status, then you're able to influence this, you're able to participate. And if you've got a good organization, and I've seen this here at Christus, then they're actually coming to you saying, hey, what do we do about this in this example, this AI stuff? And you tell them exactly what I just said. So here's how we need to incorporate into governance, right? And you guide them. So it's a two-way street. You're leading and influencing and going to them. But also, if you've got those relationships, I'd be very surprised if Reed and Tanya, they weren't the first people to get called when their organization was, hey, what do we do about AI governance?
Yeah. So let's
Yeah.
get a round of thoughts. Reed?
Yeah, I think that's well said. And if I can just belabor my flashlight analogy a little bit longer, if you'll just humor me, this idea of, you're right, Anthony, like there is leadership role that we need to play. And you think about a flashlight on a dark path at night, it lights the way, it can also dispel fear by kind of highlighting things you're not quite certain what's there. And I find, like Stuart was saying, that, as we do that, we might be kind of leading those initial steps, but then we really want others to kind of quickly come along and stand beside us, and sometimes stand ahead of us on those areas we've kind of shown the light, to help have the operational leadership. Because at the end of the day, we are very sensitive to operations. The technology is there to serve them and serve our patients, and that phasing is super important to us.
Yeah, Tanya, I think to me, it's like clicking mentally, like I'm finally getting it, which is, yeah, we've always said that IT shouldn't lead, but as we've said here, IT has to lead and it to the point of telling other people when they need to lead. Meaning, they come to you and say, "What do we do?" As Stuart said, "What do we do about AI?" And you say, "Okay, here's some structures we can put in place, and here's who's going to lead it." So you're leading to tell them who needs to lead, and it's not you, right? You're going to support and partner. Anyway, your thoughts.
Yeah, everything's been really well said again, but yes, so in our overall governance framework, including the AI framework, we like to say operationally led, IS supported. So all of our committees do have a chair from operations. Co-chair comes from the IT function. But I kind of think of it as like a train the trainer type of model. So we are the experts. This is what we live and breathe every day versus, some of our chairs are busy in surgery, for example. So I like to call it kind of coaching and leading behind the scenes so that operations gets to be in that driver's seat, but we really are partnered side by side. We've got some, clearly defined roles and responsibilities of what the chair is responsible for. But again, the co-chair is someone from the IT department and really helping to facilitate and help guide. And then from an optics standpoint, from an organizational readiness standpoint, we've got that key leader from operations helping to drive where we're going. And also, I like what Reed just said too. Like, we're really here to support our organization, to support the operations. There's very little that we do that's in support of IT. So
Mhm.
how do we leverage and really tell that story of how we're affecting and impacting and strategic, being that strategic partner for our operational improvement initiatives?
All right, very good. I'd like to go back to something we discussed earlier, this concept of not needing sort of an additional governance structure completely, yet a number of you mentioned about a layer and adding different components and then weaving them into the existing structure. So it's not purely we've got everything in place. There is an additional element of creation and adding on and then weaving in. So if you can just explain your thoughts around that a little more, that'd be great. Stuart, you want to start?
Yeah, it's difficult to explain because in some ways that additional layer is in response to the visibility, if you would, around AI.
Mm-hmm.
Right. So at this level, I would imagine everybody at this point, sorry, every board is asking about AI. So
Right.
where you might not have had, as much involvement from people who prep for the board on other technology initiatives, right? Maybe, once a quarter or something, we've got something big. Now this is a standing conversation in every place. So that extra layer is where you now have people who are looking at this and they're looking for things like, the ethical considerations and all these different things. And what additional risk are we doing? Because one thing we can say about AI, many things, but one of the things is it's changed the places that risk might emerge and how quickly they can emerge. So it gets a different level of attention in my mind. So you've got additional layers of people, usually from your CEO's office and other places, who now want to know more and be more intimately involved with technology decisions that involve AI, where they might not be as intimately involved. They don't need to be as intimately involved with other technology decisions.
Okay. Very good. Reed, thoughts?
Yeah, I think that's kind of a blend of operational execution and also the governance approach. And so, to your point, yeah, we want to build on existing governance. So, just I'm oversimplifying here, but like at a macro level, we stood up an AI center of excellence. So it's a functional team. It's resources. They kind of act as a control tower. They're evaluating third-party solutions. They're managing the inventory of AI activities happening across the system. They provide consultation. There may be technical reviews that come out of this group that flow into our new tech solution review. That was an existing governance structure. From there, we stood up an AI advisory council. This is a cross-functional group that I kind of mentioned before: nursing, informatics, legal ethics, etc. They provide, like it says, they provide advisory input into AI topics that come up. Then from there, we have an existing technology investment committee that's in our governance structure that has the final kind of enterprise investment making authority. And so you might think, well, man, those layers, like, that just seems like you're adding like bottlenecks. So we've intentionally like said words out loud to say we don't want this to be a bottleneck. We want this to be more of a braided rope that helps us climb higher together. But it, like, so far it's served us well as we're still in this kind of learning mode for this brave new world. And we continue to be curious and willing to kind of tweak and adjust it. But that's an idea of how we're layering new governance elements on top of what's already there today.
Tanya, anything you want to add there?
Yeah, so I mentioned this already too, but we're trying to leverage the already existing governance framework, but we have added a couple layers specifically around AI. So I do like this entire conversation around how do we put the right structure in, but don't impact the pace and the speed that we need to continue to move the needle on all of these things that are coming our way. But that said, we do have a few structures that we've added in our framework around AI, starting with advisory groups. So we do have an advisory group across Stanford Medicine that helps with risk, cybersecurity, compliance, et cetera, making sure that we have some standards in place on what we call AI and how we're going to approach it. Then we also have a couple layers around very specific examples of AI, so translational data science, and taking that inventory of what are we going to call AI and helping to evaluate those tools that we've already deployed, as well as the things that we want to consider. On top of that, we do have an oversight committee. This sounds very similar to what Reed was describing, where we've got a multidisciplinary group of folks that are helping to evaluate our policies. What are the tools that we want to look at, and how do we ensure that we're using it effectively and responsibly and safe, et cetera. That all reports up to our overall framework for analytics, as well as overall IT executive steering. So it has added a couple layers, but I don't think it's necessarily slowed us down. And the other thing we're trying to keep our arms around, and this is not specific to AI, but there's so many folks out in the organization that are evaluating it as well. So how do we get our arms around making sure that they're aware that we do have this structure, and we do want to make sure that we're compliant and evaluating through this structure instead of kind of folks developing stuff on their own. So that's the other piece we're trying to get our arms around.
Same.
So Tanya, that's like a shadow, we had shadow IT, gray IT, where people are buying stuff outside of the regular IT governance structure. And that sounds like something similar. It's shadow AI development where things are happening. I don't know if you necessarily mean things being purchased, or it could just be, things being developed. Because at least with purchasing, you get a trigger sometimes with contracts and whatnot, and things coming onto the network. But I don't know if you would get the same thing with sort of somebody working on an algorithm. And again, I get way beyond my level of technical expertise here, but tell me more about what you mean by that.
Yeah, it's a little bit of both. We
Hmm.
we tend to do more buying versus building on our own. So again, leveraging the vendors that we already have relationships with. But even that is a lot to stay on top of. So some of our key vendors, Epic, Workday, even Zoom now, and Microsoft, like they're all developing their AI roadmaps, and tools are coming out very quickly and rapidly. So it's just how do we stay on top of some of those developments with our existing partners that are managed outside of this AI framework. So again, Epic has its own structure for governance, for example. And then there is a little bit of, we are a research institute. So of course we do have researchers and clinicians that are coming up with ideas and have capabilities to play with some of these large language models, et cetera, that are coming out. So it's a little bit of both. And again, it's awareness and education
Huh.
for both sides on how do we make sure we're funneling things through this framework.
And Tanya, you just brought up a very important point that, that goes back to this idea of you really can't just separate AI governance from the rest of your governance,
Mhm.
right? All of our major vendors are deploying AI natively within their applications, within their software. So you can't have one structure that governs Epic and then a separate structure that governs AI within Epic, right? They're just not two separate things. So we've got this framework that we look at from an AI perspective, and we've kind of grouped them into three buckets. There's embedded AI, which is exactly what it sounds like. It's embedded in one of our major platforms, right? This vendor just evolving and adding AI. Still needs to be identified and governed. One of my best examples is where one of our clinical reference vendors says, "Oh, congratulations, in 2 weeks, we're going to be releasing all these AI features, and it's a cloud-based system, right? And it's just on." We're like, whoa, whoa, whoa. We can't just turn something on without understanding what it is and checking to make sure that it's ethical and transparent and all the different guidelines we have. So governing embedded AI, right? That's just part of release management. How do you govern your existing vendors? So this is part of why I caution against getting a big separation between AI governance and your regular governance. The second form is what we call API, right? You've got a third party ambient voice or something that'll plug into your EMR, and you govern that differently. And then the last one we call platform, which ties into what Tanya was saying, where we have our own LLMs and we have our own teams who are working to develop AI solutions. But all three of those things need to be governed. All three of them are either natively embedded in your natural governance because they're part of Epic or Microsoft or whoever you're working with. The API ones integrate with those and still need to be governed. And even your platform, at some point, you're tying into your existing infrastructures. So really, really important that we retool and upscale our existing governance structures to deal with AI versus trying to create this parallel universe. All of the structures that everyone's mentioned, Reed did a good job of laying out the different committees from the small group that vets it and comes in. That exists for every technology that we bring in, right? At least the major technologies. So it's not something new that we're adding because of AI.
As brilliantly said, Stuart. That was really good. I think the interesting concept is that, or one of the interesting concepts you mentioned is that a, a release has changed. The importance, a new product, an upgrade. Take the upgrade, take the update. That used to perhaps be sort of a basic process, like not a big deal. Okay, you're going to get these new features and functions. But AI sounds like it's fundamentally changing the risk profile of taking an upgrade. If you're taking an upgrade that's got new AI in it, that is a different scenario than it used to be. Is that correct?
It can be, and this is an example of where your governance matures, right? Your major governance committees would not necessarily get involved in an upgrade, right? So now you've got to adjust your processes and your thinking to say, if this upgrade includes a significant AI component, it's got to be kicked out of the regular upgrade governance into the major governance for approval, right? Those are the types of triggers you've got to look out for so you don't just inadvertently deploy AI that doesn't go through the higher level governance filters, especially when it's brand new to a vendor who's never had that particular AI capability, right? It can be fundamentally different in terms of the risk profile that would require it to go through a higher level of governance than a regular upgrade would go through.
Yeah, and I think it's brilliant. I want to bring our other folks in here and to sort of give me their thoughts. And what Stuart said that I found interesting in the last comment was significant, right? Because we need definitions in these things. If an upgrade is going to cause or need to be evaluated in a different manner, and we say a significant AI element, what does that mean, right? Because we need to have a specific definition of what significant means in terms of the capabilities they're talking about injecting, and that will be the trigger that kicks it over. Reed, I'd like your overall thoughts on what you're hearing.
Yeah, so kind of building on what Stuart's describing, our governance framework is consistent, but what we found is the lens we look through will shift depending on the domain. So, for example, a clinical use case is going to receive a lot more scrutiny around explainability, safety, patient trust. Operational and admin tools, we're often more focused on scale and efficiency. but the core principles still stay the same. And as Stuart was talking into our earlier question about like who's leading, if you think about this governance framework and the different lenses you might look through, like ultimately, I feel like our IT team owns the structure, but we distribute the accountability. So this AI COE that I described, they corral the right people, they keep things moving, they make sure no balls get dropped. But we don't think about ownership of that as control so much as about coordination and stewardship. And so one of the kind of our phrases is that if everyone feels a sense of ownership in the governance, then nobody is going to intentionally or unintentionally shirk accountability. And so far, still early, that approach is serving us well as this.
All right, very good. Tanya?
Yeah, so far, I haven't had an experience where we were surprised by anything that came out of an upgrade by itself necessarily. So we do still have rigor and what we'll call governance around what we turn on and off when we are looking at features or new upgrades and capabilities. I agree with what Reed said. We are probably a little bit more, well, a lot more prescriptive and do a lot more analysis when it has a clinical impact potentially around some of the AI tools that are coming out. More so than on the administrative side. Those are, we're probably quicker to adopt some of that. But we do have rigor around all of our implementations on what we are going to turn on. Hopefully our vendors are transparent about those features and functions that we can turn on and off versus what is coming innate to the next platform. So fortunately, I don't think we've had anything like that that surprised us yet.
All right, very good. Well, let's get a little bit more into what good governance looks like. It had been mentioned the different elements that you want to. I know this stuff is phenomenally complex, right? We also know it's super important, as Stuart has mentioned, and everyone's mentioned. So governance is absolutely critical, but there's not one definition of governance. So, what do we want it to look like? Ideally, like I know everyone has governance structures in place, but what do we want it to look like? What do we want to happen? What voices do we want on these committees? How do we not let this get too complex? And the other thing I find interesting about governance is, you know, who's creating it? Like, who's ultimately designing these governance structures? And then how do they get adjusted if they're suboptimal, if there's a problem, if things aren't moving and things are muddled down? Who looks at that and says, here's the bottleneck, here's the problem? It's in some sort of loop, or it goes, this kid dies in this committee all the time. What's going on here? Oh, we find out that there's an individual in this committee that just is killing everything. Like who fixes governance? So a lot of questions there. I'll let you jump in wherever you want. Let's start with you, Reed.
Yeah, and I don't want to be repetitious. As you were kind of teeing this up, I thought of, we definitely don't want to be perceived as a gatekeeper. We don't want to be perceived as a group that says yes or no. And in fact, we try and not say no. It's typically a not now or tell me more. So as we've described previously, we try and build on existing governance. We intentionally embed our AI reviews into our broader governance processes, so it happens in parallel with our security review, our tech review, our data reviews, rather than a sequential kind of build on each other approach. I found this has helped us move faster because we're often early consultants during the AI kind of process. Teams don't feel policed; they feel supported. And so it's really, think about it from the standpoint of UX. So I think good governance done effectively feels like good user experience design. It just kind of fades in the background and it makes everything else smoother. So that's kind of the measuring rod that we use. If we start to sense or hear friction points, that's kind of a flag that we're doing it probably the wrong way. So good governance for us isn't just about saying no; it's about making sure that we're saying yes, but to the right things.
Yeah, and you use the phrase if we hear about bottlenecks. I mean, is that kind of informal, like that feedback loop?
Yeah, it's open transparency. Again, one of our AI principles is transparency. And so sometimes it's just direct feedback. Sometimes it's just, when you've been in this organization long enough and know people, you just get a sense when there's kind of those hassle factors starting to build up. And so that proactive reach out to kind of understand what's going on, and have we strayed into that lane of being a bottleneck versus being an enabler, and just making that a real time ongoing dialogue because it's so fluid.
Yeah, Stuart, what are your thoughts? This seems super important to me, right? Because if we've got this and it's not working efficiently, then we're in big trouble. But if we get it right, things can be evaluated at the right level in the right way and move smoothly through the process. Your thoughts?
So one of the traits of any high performing organization, and that could be, I think, organization as the organization that you work for, or just the governance function, is this idea of continuous improvement, right? We
Yes.
live in an ever changing world, so whatever we do in our governance structures, it has got to be intentionally self healing and maturing. So evaluating your governance processes periodically to see what works is a fundamental tenet of what you should do in any high performance framework. You see would have an element of continuous improvement and learning. We need to have a commitment to things like after action reviews, right? If something doesn't go well, how do we study it and learn from it? So if we, thankfully we haven't had this, but if we had an AI that was released into production that didn't go through the right channels, right? How do we go back and A, correct it, and then B, learn from it and go back and see where did the process break down to allow this to happen? That type of continuous improvement is really, really key. I also like something that Reed said, which is, governance is not just there to enable, right? We're there to govern, and we don't like to say no, but sometimes that's one of the hardest jobs of governance is to say no. No, that's not safe. We're not going to do it. Right? We know you love all these little AI assistants that you can get free and plug them into every meeting, but we're going to not allow those because we don't need our data uploaded to some model that we don't control and don't know where it goes. Right? There have been companies that have lost their IP because somebody used AI and then their IP gets out in the public domain. So governance should not be afraid to say no when no is necessary. But culturally, right, we no is not something that's popular. We have to stay away from that. And like Reed said, we're often in the not now. And part of the problem with the not now, at least from my perspective, I don't want to speak for everyone else, is it bogs down your pipeline, right? Because everything you ever discuss, if it doesn't get a yes, it just stays in the pipeline as you're trying to prioritize. It's just kind of hanging around. And sometimes you have to say no. We don't do this here, but a previous organization I worked at says if something was approved and it didn't get executed after 3 cycles, and the cycle was 90 days, we did this quarterly, it became unapproved, and you have to re-justify it because we can only do so many things at the same time. And what really happens if it's important enough, it gets done, right? Either you're fighting a fire or there's a big enough operation, whatever it is, the things that are important enough get done. So if something organically hasn't gotten done, it means it's not a priority in that moment. If it's not a priority in that moment, you're now 9 months, a year into when it was first justified. It needs to be rejustified because a lot has changed in it. That's the most mature version I've seen, and it wasn't popular at all, but it worked very well. If you don't have that, if you have okay, yeah, let's keep an eye on it, maybe we'll get to it, you just end up with your pipeline just keeps growing and growing and growing, and your governance job gets a lot harder.
I love that. I absolutely. We've all have our to-do lists with those things that you just never ever do, but they're on your to-do list. Just cross it off, get rid of it. You're not doing it. So I like that. That's very, very good. Stuart, just a quick follow-up, and then we'll bring in Tanya. So I know we don't want to own, as IT, we don't want to own the process, shared responsibility. We're all friends, kumbaya. I get it. We're all going to work together hand in hand, and nobody's in charge to a certain degree. But um, do you own the governance improvement? Like, do you own that part of it?
I still think it's shared ownership, Anthony, and I get this idea of like ownership, and IT has the burden of ensuring that there's governance, right? But I think we do that through influence. And if you look at one of the tools we use, something called a RACI, RACI, it's an acronym, right? It's a beautiful tool in my mind. So we always get the R. Responsible means that we'll do some hands-on, right? We're a part of the process, but the accountability doesn't necessarily sit with us.
Uh-huh.
So we always, always, always in the governance have the R. It is our job to ensure that there's governance and to enable it, to help it, and to make it self-correcting and to serve as that trusted advisor. So if we wanted to get down the path of hard ownership versus shared ownership, I would say that ownership, the ultimate owner, is the person who gets the A, right? So who is accountable for ensuring that there's good governance? If we agree that we're always responsible, right? We don't just get to sit on the sidelines. We should be the ones making it happen and doing the heavy lifting and being those trusted advisors. And as I say, always making sure that the organization is making informed decisions about technology, right? That is our job, is to always make sure that they're making informed decisions. So I think it's hard to get away from shared ownership. It is very hard to get away from that as a concept. The only way it works is with shared ownership and good partnership, right? This works best when you've got a CIO who is working effectively as a dyad partner with a CMIO or an operational lead or a CEO, right? Somebody operationally,
Mhm.
that IT dyad that works really well is key to our success.
Perfect. Tanya, you want to jump in there?
Yeah, there's so much that everyone has already said that I want to chime in on, but I'm smirking a little bit because I want to count how many times we've said the word governance in this conversation, because in a prior organization, different place, the word governance itself was shunned.
Yeah.
It kind of gave people like perks. So I've had kind of one extreme to the other in different organizations. So one organization thought we couldn't even use the word governance. We don't want any of that bureaucracy. We just need to get stuff done. Put me in a difficult spot for that shared decision making for sure. And then on the other hand, I have been in, the many layers and structures that is consensus driven. So everybody has to have an opinion. Everybody wants what they want. So I've kind of seen both extremes. So a perfect model would be, somewhere in the middle where we do have that shared ownership. We're hopefully making the right decisions together. We're sharing that responsibility and accountability, but keeping a decent pace at the same time. And I do think we now have more responsibility, maybe perhaps more than ever, with so much coming at us so quickly, that we do need to continue to keep that pace and momentum going. And so I think something I'm working on that I don't think we've done a great job at as a healthcare IT industry is going back to measure. So I do
Mm.
think we're holding ourselves more accountable now, particularly around AI, because there's so many questions about efficacy, et cetera. But how do we hold ourselves accountable to taking that look back, measuring, was it safe? Did we accomplish what we wanted to accomplish? Holding ourselves accountable to doing that. Because again, historically, I feel like we've been focused on perfection. And so we just kind of keep, tweaking it to try to get it right. And, we never really achieved the ROI we thought we would. So that's something I'm working on from a governance framework too, is holding ourselves accountable, doing the fail fast if we need to, pivoting if we need to, but making sure we're having good metrics in place.
Yeah, and Tanya, so I know I'm beating a dead horse, but so with evaluating a particular use of AI, and Stuart laid out very well different ways it can be in the organization. It can be part of one of your existing applications, could be somewhat what you created, could be some kind of standalone thing. But evaluating what worked and what didn't, we want these things to be operationally led and operationally selected. They're obviously operationally used, right? These algorithms and these AI tools are used by operations, but we're also saying that it's part of IT's responsibility to evaluate the efficacy of these tools. How does that work, Tanya? You see what I mean? What you just referenced about measuring, what are we measuring and who's measuring it?
Yeah, so I'll give a recent example. I think we probably all have similar examples, but everyone was really excited. We still are about ambient voice recognition, for example. There were some concerns around, well, is it safe? Is it accurate? You know, especially in the pediatrics environment, it's not always the patient that's doing the talking. But once we felt, so we did some piloting, wanted to make sure we could answer those questions. When we felt it was safe and we answered all those questions, we were ready to do widespread deployment. And we put a business case together on how we were going to measure its success. And there's so many pieces and parts of how that can be measured, everything from physician productivity and efficiencies to potential volume growth because we're able to have better throughput, to we're removing scribes because we no longer need them. So there was just such a strong business case and so much excitement around it that we did rapid deployment, and that's actually underway right now. But that's a really good example of we have all the right thought leaders in the room to talk about how we're going to measure this and then actually measure it before we move out of that pilot mode. And then now that we're in the deployment, we're still measuring. We have scorecards that we've developed and dashboards that we've developed to really help track if we achieved what we thought we would achieve. And that's a really recent example, but with every AI initiative that we're looking at, we should have something similar. What is the scorecard? What is the metrics? How are we going to measure its effectiveness?
Very, very good. Go ahead, Stuart.
Piggyback on that, Anthony, I would just second everything that Tanya just said, right? And we should be doing that for every technology initiative. And you say, what do we measure and who measures it?
Yes.
What do we measure is determined by operations and governance, right? They make the business case, they say what it's going to be. Who measures it? That's the art that we get on the IT side, right? We put the tools and processes in place to generate those dashboards and reports and give to them. We're the ones, and ambient is a great example, right? It's taking off faster than anything I've ever seen, but there's not a financial ROI on ambient, right? It's going to be about the physician quality of life. It's going to be your ability to recruit new physicians. It's going to be about reducing pajama time. So
Yeah.
once those metrics are defined by operations and the governance structure, then it becomes our challenge, right? Well, how do we measure that? How do we know we're seeing a benefit? Especially for something like ambient, where it is more qualitative than quantitative benefit, right? In many ways, there are some things we can quantify, but that partnership again of saying what's important, and then IT coming up with here's how we can measure that. Here are the dashboards and reports that we can help you with to do that is a key. And then hardwiring some accountability sometimes helps, right? The big example I like to give is this is many years old, probably 2 decades old, is back when Dragon was first becoming a thing. We had an APM director where I worked who made a very strong business case for Dragon because we were going to save $1 million a year on transcription. And after like an hour and a half of arguing, and not arguing, but debating, convincing, we approved the project. About 3 weeks later, governance was talking about the budget for the upcoming year. And we cut the transcription budget by $1 million. The very same person who made the case in the last governance meeting to get the investment for the technology almost had a heart attack and was arguing passionately that we couldn't cut the budget for transcription. And we reminded her, you convinced us to make this investment at the expense of other investments that we could have made because it had this return. So hardwiring that accountability as part of governance, if and when you can do it, is a beautiful thing. All right. Now, if for some reason we don't see the benefit, now we're going to be over budget on transcription, right? And that's something you report. So that now in itself becomes a way of measuring the success. We were supposed to see $1 million savings in transcription. We did not. Why is that? Is it because the business case was off and we need to scrap this when we can? Or is it because the adoption is not there and we need to go back and work with our providers to educate them and get the adoption up? So that's bringing measurement and accountability together, which is a very mature level of governance, in my opinion.
Yeah, I love the expressions mature, high level. Reed, you want to jump in?
just a comment on this, and it's great. Tanya, I'm glad you raised this idea of benefits realization. It's so important. Deployment isn't the finish line. It's just really the handoff to ongoing accountability. So the ambient topic is fascinating. So we've had a hard ROI from our ambient listening capability through better risk capture. But what we've learned is that as we were capturing that and sharing that, we then had RevCycle come forward. We had other groups come forward and say, well, wait, we did these process improvements, or we have this tool. So we unintentionally created kind of a zero-sum game then, where there was competing kind of claim to what the benefit is. So I just want to underscore the point of that shared governance kind of mindset up front, clearly defining the metrics you're going to track, how often, who's accountable, so that you don't get to the past the finish line and then start to have this kind of incongruence about, wait a minute, like, where did the benefit come from? Because it should be a shared conversation at that point of, as much as you can attribute the benefit to the tool or the process improvement, and maybe where it's gray, like, how do you then share that as complementary initiatives that work together to provide that benefit? And that's not a challenge we've had before with past deployment. So this is kind of, again, I think, the new world of AI, where it moves so quickly, and sometimes that benefits attribution can be a little more challenging to clearly affix to what you've done. So it just underscores the importance of defining that as tightly as you can up front, and then it makes the back end rationalization a little bit easier.
Yeah, it's just super important, right? Because this has to do with how we're going to spend money going forward. So
Mhm.
we've made an investment based on certain assumptions. Usually, I guess, Stuart, the business case is made by the users, by operations. They're saying we want this, or we want to use this, or whatever, and here's what we think is going to happen. And IT says, okay, we're going to support your implementation of this. We're going to help you buy it. We're going to help install it, maybe help set up the training. There you go. We supported you and gave you what you said you wanted to do your jobs better. Now we're going to help figure out if some of those if that upside has been realized. And if we find out that it wasn't, then the organization may not want to continue investing in this tool, and you want that all to be transparent and the users involved every step of the way, because if ultimately it's decided we are not going to continue investing in this tool and the tool's not available, you don't want them up in arms at that point that this was some sort of sudden decision.
Yeah, Anthony, one thing I would just add to that is that that person that doesn't just go in on their own and make the case and we say, okay, yep, we believe you, right?
Mm.
We partner with them in building that business case. We help them to do the assessment. We help them to put that case together. So we're partners with them, even if they're bringing the business case forward, but it should be championed by them, even if the genesis of the idea comes out of the IT side of the organization. And let's just say it's a matter of records, right? We would go to operator and say, hey, we believe this can help you, right? And then we
Yeah.
would jointly make the case to see if we go forward. So I just want to underscore the level of partnership and collaboration that goes in all along the way. That person is not on their own making the business case. Before they get to that point, we would have worked with them. They would have gone through all those lower levels that Reed described so eloquently earlier, right? Where we flesh that out. So by the time it gets to the point of approval, it's not just one person saying, "Oh, I heard about this, or I saw it at a conference. I think it's going to work." We have worked with them as partners to get a good business case together, and they know what they're going into.
And as part of that process, you could certainly and probably often come to the point where you say, we work this up and we can't support this, right? It just, the numbers aren't there, and they may be disappointed. Does that sometimes happen that way?
It does, and hopefully when that happens, it happens before they ever present it to governance, right? And working with them to prep, we will
Ah,
identify those. So again,
okay.
don't ever leave them hanging. They're not in there kind of going in front of a tribunal on their own.
Right. So that's a pre-governance. That happens before they even get to governance, is you partner with them to see if a business case can be made. If it's made, you go with them through the governance.
Ideally, if this works out well, and I'll yield to Reed and Tanya and Anthony, I apologize, I'm watching the time. I've got one at the top of the hour that I need a little bit of transition
Yeah,
time.
yeah. We're gonna finish up right here. I'll just final word from Reed and
Quickly,
Tanya.
as they're going, ideally, that would have happened by the time it gets to governance with that, we know it can work, or we would have said, no, we don't think this is going to work and stopped it in partnership with our
Yeah,
operating team.
got it. If you need to jump off, Stuart, just don't worry about it. Just jump off when you need to. Tanya, your thoughts?
Yeah, I was actually hoping we'd jump into the ask a
I
panelist.
know,
I'm
I
gonna
So
email
know.
you
before
offline,
we
Tanya.
leave,
I have questions.
yeah.
And
So one of the challenges, and I don't have an answer for, I'm working through it, so curious what your thoughts are, but exactly what we just mentioned. So we're investing in technology. So ambient voice or take on ambient voice recognition, that increases my spend. So that's the spend is going to be on the technology budget side, but the benefit is going to be somewhere else. So kind of like the transcription example, holding the accountability of removing that cost because my cost is going up. Well, we're all facing budget constraints. I know we're all facing the headwinds coming our way. I'm curious if you have thoughts on how we continue to tell that story of, hey, you're not going to get the cost savings from my budget
Yeah.
necessarily. Really have to hold that accountability outside of my department.
All right, Reed, I think Stuart's got to jump. So Reed, your thoughts on that?
guys,
Yeah,
Take
I'll
care,
answer
Stuart. Thank
that
you
and
so much,
see you,
Stuart.
Stuart, and then share kind of a parting advice. So, Tanya, this is very much aspirational, but we are trying to really move to a spot where we use net present value. So when something gets submitted, there's an NPV calculation. So to your point, let's say a clinical operator has something that grows my budget, but in the NPV, they're saying, well, yeah, but it's going to reduce, resource capacity or whatever down the road. Today, we capture that and then just kind of move on. Like I want to see that built into that operational leader's budget for that fiscal year when they claim that benefit's going to actually hit. So then bottom line for the system, right? It kind of balances out and it's not just viewed as, well, Reed, why is your budget growing like 10% year over year with all these new tools? So still early days, but like conceptually, that's kind of the way we're thinking about it. And then I
and
would just say, just imparting, this is, and I think you've heard this from all of us today, treat AI like a team sport. Build structure that supports dialogue, not just decisions. And as you do that, a lot of the challenges that are going to naturally come up, you're going to have a better chance of resolving this.
Well, this has been an incredible, Tanya. I wish we had more time. That was, to get all the questions to each other, but unfortunately, we're out of time. That was amazing conversation. I want to thank everybody. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand version of this is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team. You go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Stuart James, Reed Steffen, Tanya Towson, and I want to thank our attendees for coming. And with that, everybody have a wonderful day. Thank you.
Thank you.